CEN Written Exams Georgia. Question 1. A patient presents with suspected abuse, elder abuse or child abuse. The CEN should: Option A. Report the suspected abuse to the appropriate agency. Option B. Confront the suspected abuser. Option C. Keep the information confidential. Option D. Delay reporting until the patient is discharged. The correct answer is option A. Report the suspected abuse to the appropriate agency. Suspected abuse, elder abuse, child abuse, domestic violence, or human trafficking, is mandatory reporting in all 50 states. The CEN should report to the appropriate agency, CPS, APS, or law enforcement. The CEN should not confront the abuser. This is the role of the social worker or law enforcement. Confidentiality does not apply in cases of suspected abuse. Question 2. A patient with a history of HIV/AIDS presents with a fever and dyspnea. The CEN should suspect: Option A. Pneumocystis jirovecii pneumonia, PCP. Option B. Tuberculosis. Option C. Bacterial pneumonia. Option D. All of the above. The correct answer is option D. All of the above. Patients with HIV/AIDS are immunocompromised and susceptible to a range of opportunistic infections. PCP, pneumocystis jirovecii pneumonia, is a common cause of pneumonia in HIV patients. Tuberculosis and bacterial pneumonia are also possible. The CEN should implement appropriate isolation precautions, airborne for TB, droplet for others, while evaluating the cause. Question 3. A patient presents with a severe headache, nausea, and vomiting. The patient has a history of hypertension. Which finding would suggest a subarachnoid hemorrhage? Option A. A sudden, severe headache, thunderclap, and nuchal rigidity. Option B. Gradual onset headache. Option C. Blurred vision and photophobia. Option D. Focal neurological deficits. The correct answer is option A. A sudden, severe headache, thunderclap, and nuchal rigidity. Subarachnoid hemorrhage presents with a sudden, severe thunderclap headache, often described as the worst headache of my life. Nuchal rigidity, neck stiffness, is a classic finding. CT head is the initial diagnostic test. Gradual onset suggests a different etiology, e.g., migraine. Focal deficits may suggest an ischemic stroke or mass lesion. Question 4. A patient with an orbital fracture presents with diplopia, enophthalmos, and subconjunctival hemorrhage. Which complication should the CEN suspect? Option A. Optic nerve damage. Option B. Globe rupture. Option C. Entrapment of extraocular muscles. Option D. All of the above. The correct answer is option D. All of the above. Orbital fractures can cause entrapment of extraocular muscles, leading to diplopia and restricted eye movement, enophthalmos, and possible optic nerve damage or globe rupture. A thorough ophthalmological examination is needed. CT scan of the orbit is the diagnostic test. Surgical intervention may be needed for entrapment and enophthalmos. Question 5. Which assessment finding indicates spinal shock? Option A. Loss of reflexes below the level of injury. Option B. Muscle spasticity. Option C. Hyperreflexia. Option D. Autonomic dysreflexia. The correct answer is option A. Loss of reflexes below the level of injury. Spinal shock is a transient condition following acute spinal cord injury characterized by loss of reflexes below the level of injury, flaccid paralysis, loss of sensation, and bowel/bladder dysfunction. This phase lasts hours to weeks and is replaced by hyperreflexia as spinal shock resolves. Autonomic dysreflexia is a later complication. Question 6. A patient with cyanide poisoning, from smoke inhalation, presents with confusion, dyspnea, and a normal SpO2. The CEN should anticipate: Option A sodium thiosulfate and hydroxycobalamin. Option B oxygen only. Option C naloxone. Option D atropine. The correct answer is option A. Sodium thiosulfate and hydroxycobalamin. Cyanide poisoning often occurs with smoke inhalation. Symptoms include confusion, dyspnea, seizures, and lactic acidosis. SpO2 may be normal because oxygen is not utilized by the tissues. Hydroxycobalamin, vitamin B12A, is the first-line antidote, binds cyanide to form cyanocobalamin. Sodium thiosulfate is a second-line agent. Oxygen is supportive. Question 7. Which concept is part of the Just Culture framework in nursing? Option A balancing accountability and safety with a non-punitive approach to errors. Option B blaming the nurse for errors. Option C punishing all errors. Option D avoiding reporting errors. The correct answer is option A. Balancing accountability and safety with a non-punitive approach to errors. Just Culture is a framework that balances accountability and safety, promoting a non-punitive approach to reporting errors. It distinguishes between human error, at-risk behavior, and reckless behavior. The goal is to improve patient safety by encouraging reporting and learning from errors without fear of punishment. It is the foundation of a safety culture. Question 8. A patient presents with a sudden onset of fever, chills, and hypotension. The patient is a chemotherapy patient and has a central line. The CEN should suspect. Option A sepsis, bacteremia. Option B febrile neutropenia. Option C anaphylaxis. Option D pulmonary embolism. The correct answer is option B. Febrile neutropenia. Patients with chemotherapy-induced neutropenia are at high risk for infection and sepsis. A single temperature 38.3 degrees Celsius, or 38 degrees Celsius for more than 1 hour, is an emergency. Cultures, blood, urine, sputum, should be obtained, and broad-spectrum antibiotics should be given promptly. The patient is at high risk for bacteremia and septic shock. This is a medical emergency. Question 9. A patient has a suspected tension pneumothorax with tracheal deviation, unilateral absent breath sounds, and hypotension. What is the priority intervention? Option A chest X-ray. Option B needle decompression. Option C chest tube insertion. Option D oxygen therapy. The correct answer is option B. Needle decompression. Tension pneumothorax is a life-threatening emergency requiring immediate needle decompression, second intercostal space, mid-clavicular line, or finger thoracostomy. The condition causes mediastinal shift, impaired venous return, and shock. Chest X-ray should not delay treatment. Chest tube insertion follows needle decompression. Oxygen is adjunctive but not the priority. Question 10. A patient presents with acute onset of severe dyspnea, pleuritic chest pain, and tachycardia. The patient has a history of DVT. The CEN should suspect. Option A pulmonary embolism. Option B COPD exacerbation. Option C spontaneous pneumothorax. Option D asthma exacerbation. The correct answer is option A. Pulmonary embolism. This presentation with risk factors, DVT history, is classic for pulmonary embolism. PE should be suspected in patients with acute dyspnea, chest pain, hypoxemia, and signs of DVT. Diagnosis is confirmed with CTA. Treatment includes anticoagulation, heparin or direct oral anticoagulants, and possibly thrombolysis for massive PE. Question 11. A patient with subarachnoid hemorrhage presents with a sudden thunderclap headache, nuchal rigidity, and photophobia. Which diagnostic test is the initial gold standard? Option A non-contrast CT head. Option B lumbar puncture. Option C MRI brain. Option D CT angiography. The correct answer is option A. Non-contrast CT head. Non-contrast CT head is the initial test for suspected subarachnoid hemorrhage, SAH. It has a sensitivity of 90 to 95% within 24 hours of onset. If the CT is negative but clinical suspicion remains high, a lumbar puncture is needed to detect xanthochromia, indicating breakdown of red blood cells in the CSF. CTA may be done to identify the source of bleeding, but CT is the initial diagnostic test. Question 12. A patient with DKA, diabetic ketoacidosis, has a blood glucose of 500 mg/dl, pH 7.2, and bicarbonate 14 milliequivalent/L. The CEN should anticipate. Option A for insulin bolus. Option B for normal saline and insulin drip. Option C bicarbonate infusion. Option D potassium replacement. The correct answer is option B. For normal saline and insulin drip. DKA management includes for normal saline fluid resuscitation, continuous for insulin infusion, and monitoring of electrolytes, especially potassium. Bicarbonate is not routinely recommended unless pH 7.0. Potassium depletion is common and should be monitored and replaced before insulin treatment, as insulin drives potassium into cells. Insulin is given as a continuous drip, not a bolus. Question 13. A patient with acute stroke has aphasia. The CEN should. Option A speak loudly and slowly. Option B use simple, short sentences and allow time for response. Option C avoid speaking to prevent frustration. Option D write everything down. The correct answer is option B. Use simple, short sentences and allow time for response. Aphasia, language impairment, often expressive or receptive, in stroke patients requires patience and clear, simple communication. Speaking slowly and using short sentences reduces cognitive load. Speaking loudly is not helpful as aphasia is not a hearing problem. Avoidance limits communication. Writing may help some patients but should be combined with verbal cues. Speech therapy consultation is appropriate. Question 14. A patient who is a minor, under 18, is brought to the ED with a life-threatening condition. The parents cannot be reached. The CEN should. Option A wait until the parents are reached. Option B provide life-saving treatment under implied consent. Option C call Child Protective Services. Option D transfer the patient to another hospital. The correct answer is option B. Provide life-saving treatment under implied consent. In emergencies, implied consent allows healthcare providers to treat a minor without parental consent when the patient's life or limb is in danger and a delay could cause harm. The CEN should also notify the parents and CPS as required. This is part of the EMTALA requirements. Question 15. A patient with an amputation of the finger is brought to the ED. The amputated part should be: Option A placed directly on ice. Option B wrapped in moist gauze and placed in a sealed bag, then on ice. Option C placed in a dry bag. Option D discarded. The correct answer is option B. Wrapped in moist gauze and placed in a sealed bag, then on ice. The amputated part should be wrapped in moist gauze, placed in a sealed plastic bag, or container, and then placed on ice, not directly on the ice. This preserves the tissue for potential reimplantation while preventing thermal injury from direct ice contact. The CEN should ensure rapid transport with the patient and the amputated part. Question 16. A patient with acute pelvic pain, vaginal bleeding, and hypotension has a positive pregnancy test. Which intervention is the priority? Option A transvaginal ultrasound. Option B 4 fluids and cross-match blood. Option C beta HCG level. Option D surgical consultation. The correct answer is option B. 4 fluids and cross-match blood. This patient is hemodynamically unstable, hypotension, positive pregnancy test, vaginal bleeding. The priority is stabilization with 4 fluids and preparation for blood products, as a ruptured ectopic pregnancy is likely. While ultrasound and surgical consultation are important, volume resuscitation is the immediate priority to prevent hemorrhagic shock. Question 17. A patient with a severe asthma exacerbation is not responding to continuous bronchodilators and systemic steroids. The CEN should: Option A. Administer magnesium sulfate. Option B. Prepare for intubation. Option C. Administer Heliox. Option D. Administer epinephrine. The correct answer is option B. Prepare for intubation. Refractory severe asthma may progress to respiratory failure. Magnesium sulfate is a second-line treatment that may help, but if the patient is in impending respiratory failure, exhaustion, confusion, silent chest, intubation is needed. Heliox is a rescue therapy for some patients but not first line. Epinephrine may be given for anaphylaxis but not asthma. Question 18. A patient with COPD presents with severe dyspnea, confusion, and cyanosis. ABG shows pH 7.25, PaCO2 65 mmHg, PaO2 55 mmHg. The CEN should anticipate: Option A. Non-invasive positive pressure ventilation, BiPAP. Option B. High-flow oxygen via non-rebreather mask. Option C. Bronchodilators only. Option D. Immediate intubation. The correct answer is option A. Non-invasive positive pressure ventilation, BiPAP. This patient is in acute respiratory failure with hypercapnia and acidosis. BiPAP is the first-line intervention for COPD exacerbations with respiratory acidosis, as it can reduce the need for intubation. High-flow oxygen should be used cautiously in COPD patients to avoid suppressing the hypoxic drive. Bronchodilators should be given, but BiPAP is the priority for this acidotic patient. Question 19. A patient with a history of opioid use disorder presents with respiratory depression and constricted pupils. Which medication should the CEN anticipate? Option A. Naloxone, Narcan, 0.4 mg 4. Option B. Flumazenol, Romazicon. Option C. Naltrexone. Option D. Buprenorphine. The correct answer is option A. Naloxone, Narcan, 0.4 mg 4. Naloxone is the opioid antagonist used to reverse opioid overdose, which presents with respiratory depression, pinpoint pupils, and decreased consciousness. The dose may be repeated if there is no response. Flumazenol is for benzodiazepine overdose. Naltrexone and buprenorphine are used for maintenance therapy, not reversal. Airway management is the priority. Question 20. A patient with a history of COPD is being discharged. The CEN should provide education on: Option A. Smoking cessation. Option B. Use of bronchodilators. Option C. The importance of pulmonary rehab. Option D. All of the above. The correct answer is option D. All of the above. Patient education is a key part of CEN practice. COPD discharge teaching includes smoking cessation, correct use of bronchodilators, pulmonary rehabilitation, and monitoring for signs of infection. This is part of professional nursing responsibility. Question 21. A patient with a spinal cord injury at the C5 level is experiencing neurogenic shock. Which findings are consistent with this? Option A. Hypotension, bradycardia, and warm, dry skin. Option B. Hypertension, tachycardia, and cool, clammy skin. Option C. Hypotension, tachycardia, and warm, dry skin. Option D. Hypertension, bradycardia, and cool, clammy skin. The correct answer is option A. Hypotension, bradycardia, and warm, dry skin. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic tone. This causes hypotension, bradycardia, and warm, dry skin, vasodilation. This is in contrast to hypovolemic shock, cold, clammy, tachycardia, and cardiogenic shock. Treatment includes 4 fluids and vasopressors. Question 22. A patient presents with a peritonsillar abscess with a hot potato voice, trismus, and drooling. What is the priority? Option A, 4 antibiotics. Option B, and consult for possible incision and drainage. Option C, steroids. Option D, CT scan of the neck. The correct answer is option B. And consult for possible incision and drainage. A peritonsillar abscess presents with a muffled hot potato voice, trismus, difficulty opening the mouth, drooling, and a unilateral bulging tonsil. It requires prompt evaluation for possible incision and drainage, IND, or needle aspiration. 4 antibiotics and steroids are adjuncts. Airway compromise is a risk, so airway management is the priority. A CT scan may be done to confirm the diagnosis but should not delay end consultation. Question 23. A patient with a tracheostomy tube dislodges it. The CEN should: Option A, call respiratory therapy. Option B, reinsert the tracheostomy tube immediately. Option C, cover the stoma and ventilate via bag mask over the mouth and nose. Option D, suction the stoma and reinsert a smaller tube. The correct answer is option C. Cover the stoma and ventilate via bag mask over the mouth and nose. If a tracheostomy tube dislodges, the CEN should cover the stoma with a gloved hand and attempt to ventilate via bag mask over the mouth and nose. If ventilation is not effective, the stoma may be used for ventilation, with a smaller tube or tracheostomy obturator. Reinsertion should be attempted by trained staff. Blind attempts can create a false passage. Suction and airway support are priorities. Question 24. A patient with suspected tuberculosis should be placed on which type of precautions? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option C. Airborne precautions. Tuberculosis is transmitted via airborne particles, droplet nuclei. Patients with suspected TB should be placed in an airborne infection isolation room, AIIR, with negative pressure. Staff should wear an N95 respirator or a powered air purifying respirator, PAPR. Contact and droplet precautions are for other types of infections. The patient should wear a mask during transport. Question 25. A patient with a crush injury to the lower extremity presents with pain, swelling, and dark urine, tea-colored. Which complication is the CEN most concerned about? Option A, compartment syndrome. Option B, rhabdomyolysis. Option C, fat embolism. Option D, infection. The correct answer is option B. Rhabdomyolysis. Crush injuries can lead to rhabdomyolysis, characterized by muscle breakdown and release of myoglobin, leading to dark, tea-colored urine, elevated creatinine kinase, and risk of acute kidney injury. Treatment includes aggressive hydration, normal saline, alkalinization of urine with sodium bicarbonate, and possible dialysis. Compartment syndrome can also occur, but dark urine is a classic sign of rhabdomyolysis.